Recognizing and handling illnesses. All children become ill at some point, and illnesses spread rapidly within groups of children, so it is important to know exactly what signs to look for to identify illness. The first step in determining whether a child is coming down with an illness is to know the individual characteristics of each child in your care. Behaviors that may be unusual and indicate a problem from one child may be normal for another. Let's review the Oklahoma State Child Care Licensing reasons for excluding children from care due to illness. Appendix JJ, exclusion criteria for children who are ill. All programs. Children diagnosed with these illnesses are excluded from all programs, including programs serving children who are ill. Number 1, aseptic meningitis. 2, bacterial meningitis. 3, E. coli, until the diarrhea resolves and the stool cultures are negative. 4, untreated scabies. 5, all reportable contagious diseases until the period of communicability has elapsed as determined by a licensed physician or health department official. Programs serving only children who are well. Children with these illness symptoms are excluded from a program caring for only well children. 1, fever, defined as axillary or armpit temperature of 100 degrees or higher, or an oral temperature of 101 degrees or higher, with another sign or symptom of illness. 2, diarrhea, defined as runny or watery stools with increased frequency of loose stools. 3, vomiting 2 or more times in a 24-hour period. 4, undiagnosed body rash or pox, except diaper rash, with fever. 5, draining skin wounds that cannot be kept completely covered by a bandage. 6, sore throat with fever and swollen glands. 7, eye discharge, defined as thick mucus or pus draining from the eye, or conjunctivitis, pink eye, without evidence of allergic reaction. 8, yellowish skin or eyes. 9, severe and/or persistent coughing, where a child gets red or blue in the face, makes a high-pitched whooping sound after coughing, or coughs to the point of vomiting. 10, appears to be severely ill from an unexplained cause, such as extreme lethargy, irritability, persistent crying, difficulty breathing, or any other unusual signs. Programs serving children who are ill. Children with these illness symptoms or illnesses are excluded from Level 1 programs. However, the children may be cared for in a Level 2 program when guidelines for separation and outside ventilation are followed. 1, diarrhea and vomiting. Diarrhea, stools, or vomiting that A, contain blood or mucus, or B, are accompanied by lethargy or signs of dehydration, such as no tears, dry mouth, fewer wet diapers, or decreased urination. C, diarrhea diagnosed as giardia until asymptomatic, no diarrhea. D, vomiting 2 or more times in the previous 24 hours. E, salmonella until 2 negative stool cultures. F, Shigella until 2 negative stool cultures. 2, respiratory conditions. A, asthmatic child with respiratory distress uncontrolled by current medication. B, difficult rapid breathing or wheezing. C, respiratory conditions when the primary symptom is coughing accompanied by repeated vomiting. D, diphtheria until 5 days of the appropriate antibiotic therapy that is to be given a total of 14 days. E, pertussis until 5 days after treatment with antibiotics. F, streptococcal pharyngitis until child has been on treatment for 24 hours. G, tuberculosis until the child's physician or the local health department states the child is not infectious. 3, rash illnesses. A, undiagnosed rash except diaper rash. B, varicella, chickenpox until 6th day after onset of rash or sooner if all lesions have dried and crusted, unless cared for only with other children diagnosed with chickenpox. C. Measles until 6 days after onset of rash. D. A rash accompanied by fever or behavioral change. E. Rubella until 7 days after onset of rash. F. Roseola. 4. Skin conditions. A. Impetigo until 24 hours after treatment started. Ringworm until treatment started. Number 5. Miscellaneous. A. Conjunctivitis, pink eye, with physician's statement or 24 hours after treatment initiated unless cared for only with other children who have conjunctivitis. B. Hepatitis A until 1 week after onset of illness. C. Mouth sores with drooling. D. Mumps until 9 days after onset of parotid gland swelling. E. Pawnworms until treatment started. F. Post-operative convalescent care. Next, let's review the steps caregivers are to take if a child becomes ill while in care. Document the symptoms on an illness report. This record will help determine if the child is truly ill and will help caregivers communicate effectively with the family. Contact the child's family and arrange for the child to be picked up. Care for the child apart from the rest of the class until the child is picked up, making sure the child is appropriately supervised and monitored. If the situation involves bodily fluids, such as vomit or diarrhea, caregivers should pay special attention to hand washing and sanitizing and disinfecting.